This training module outlines the protocol for assessing and treating scorpion stings, focusing on species in North America to help responders differentiate between minor and severe envenomation. The majority of scorpion stings in North America are not medically significant, typically presenting with localized pain, minimal swelling, and warmth that usually resolve without major medical intervention. A notable exception is the bark scorpion, found primarily in Arizona, New Mexico, and the Colorado River Basin, which possesses venom that is significantly more potent than other species. Initial symptoms of a bark scorpion sting include intense, sharp pain, often followed by a numbness or tingling sensation that can spread from the site across the affected limb. In severe cases, particularly among pediatric patients, key indicators for escalation include abnormal involuntary movements of the head and eyes, increased saliva production, profuse sweating, and extreme restlessness. The most critical complications involve severe involuntary muscle twitching, life-threatening hypertension, and subsequent respiratory distress, all of which require immediate and intensive medical monitoring and intervention. For minor stings, the approach is palliative. Applying a cold compress can reduce swelling, while topical ointments containing antihistamines or anesthetics may provide necessary symptomatic relief for the patient. Severe envenomation from a bark scorpion requires immediate clinical intervention, which may involve intravenous sedatives to control muscle spasms and specific medications to manage dangerous spikes in blood pressure. A species-specific antivenom is available and highly effective at reversing symptoms. However, its use is restricted to life-threatening cases due to the inherent risk of severe allergic reactions. It is important to note that scorpion species in other regions, such as Turkey, the Middle East, and India, possess even more potent venoms that necessitate different treatment protocols. The presence of any systemic or neurological symptoms, especially following a suspected bark scorpion sting, mandates immediate transport to a medical facility for advanced care and stabilization. In summary, the distinction between localized pain and systemic toxicity is the critical factor in the treatment decision-making process, ensuring patients receive the appropriate level of medical response.